Hi, how are you today?
I'm doing good. How are you doing?
Good. My name's Marissa. I'll be your student nurse today.
Okay.
Just going to put on some gloves before we get started. All right, and can you go ahead and verify your full name and date of birth for me, please?
Samantha Hall, June 16th, 1998.
Okay, that matches your band as well as your chart. And your medical record number?
12345.
Beautiful. And do you have any allergies to medication?
No.
Food?
Nope.
Latex? Tape?
Nope.
Or the environment?
No.
Beautiful, and that matches your band as well as your chart as well. Next, we're going to go over your vital signs. Your blood pressure was 120/80. Heart rate was 68 beats per minute. Respiratory rate was 15 breaths per minute. Your oxygen saturation was 99. And your temperature is 98.7. These are all within normal limits, which is good. Next, we're going to check for your level of consciousness. You seem to be in no apparent signs of distress. Your body is symmetrical. You've already told me your name and your date of birth. Do you know where you are right now?
Hospital.
Beautiful. And do you know around what time of day it is?
Nighttime.
Okay. So she is alert and oriented to person, place, and time. Next, I'm going to go ahead and check your equipment, starting with your nasal cannula.
Mm-hmm.
Is it comfortable for you?
Mm-hmm.
Perfect. And I'm going to check the tubing, making sure that there are no signs of edema, erythema, or skin breakdown behind the ears, and there's not, as well as lesions, free of everything. Next, I'm going to check the tubing, make sure there's no kinks, as well as making sure what is being administered matches the provider's orders, and it does. Next, I'm going to check your IV. Beautiful. Do you have any pain with the IV?
No.
Okay, and there is no erythema or edema present. Next, I'm going to check the tubing, make sure there's no kinks, as well as that the solution being administered matches the provider's orders, which again, it does. My patient does not have a urinary catheter, but if she did, I would check the site of insertion, making sure that there was no skin breakdown or irritation. I would also check to make sure that the tubing was secured to her leg properly, making sure that there were no kinks, as well as assessing what was in the bag, checking the contents for color, consistency, as well as smell, any abnormalities, as well as checking to make sure that it was not full or needing to be emptied. All right, so after that, I'm going to go ahead and check your hair. Hair is clean and neat, and I do not see any signs of skin breakdown, lesions, or rashes, which is good. Next, I'm going to check your skin. Skin is warm and dry with no signs of edema in the hands or arms. Again, skin on the legs is warm and dry with no signs of edema. There are also no lesions present. All right, after that, if you could hold your hands out for me, I'm going to check skin turgor. It is equal bilaterally with no tenting present. And next, capillary refill. Capillary refill is equal bilaterally in both hands, being less than 3 seconds. Next, I'm going to check in the feet. Again, capillary refill is normal bilaterally, being less than 3 seconds. Next, I'm going to be checking your ears. I do not have my pen light yet. It has not shipped to me yet, so for the sake of this video, I will be using the flashlight on the back of my phone, but in a clinical setting, I would be using a pen light. All right. Ears look to be regular with no signs of irritation, edema, or erythema, or lesions present, as well as there being no drainage. All right, next I'm going to go ahead and check your eyes. If you could put your hand up like this for me and just look straight at me. Beautiful. Pupils are equal, round, and reactive to light and accommodation. And next, if you could follow my pen with just your eyes. Eye movement is equal bilaterally, showing no distress of the muscles or nerves. Next, I'm going to check your conjunctiva. I'm just going to pull down slightly under your eyes. Conjunctiva is pink and moist, and sclera white. Next, again using my phone light, I'm going to be checking your nose. If you could tilt your head slightly back for me. Mucous membrane is pink and moist with no signs of drainage or lesions. And if you could open your mouth and stick out your tongue for me. And again, mucous membranes appear to be pink and moist with no signs of lesions. And next, could you smile for me? Beautiful, and my patient's face is symmetrical. After that, we're going to check your respiratory system. You seem to be in no apparent signs of distress when it comes to your breathing, and you don't seem to be using any accessory muscles to assist with your breathing. Are you experiencing any difficulty or discomfort with your breathing?
No.
Perfect. And I'm going to go ahead and listen on your back for your respiratory sounds. Anytime you feel my stethoscope touch your skin, please take a deep breath in and out for me, and if at any point you feel lightheaded or dizzy, let me know and we'll take a break.
Okay.
I'm going to be using the Greek key pattern to assess this. I have sterilized my stethoscope before putting it to patient's skin, and I will be using my diaphragm to do this. Move your broth just slightly. And last one. Perfect. Breathing sounds are clear and equal bilaterally with no extra sounds. And we do not have an incentive spirometer, but if we did, I would instruct the patient on how to use it and then have her demonstrate it back to me. Next, we're going to check your cardiac sounds as well as your pulses. I'm going to start by checking your carotid pulses, doing it one at a time. Okay. Perfect, and there are no signs of thrills present. If you could put your arms out, checking for the radial pulse, beautiful, and pedal pulse. Beautiful, all pulses are present and regular with no signs of thrills. Next, I'm going to listen to your carotid pulses, and I will be using the bell of my stethoscope to do this. All right. Perfect. And sounds are regular with no signs of bruise. Next, I'm going to check her PMI. This is located on her 5th intercostal space, left mid-clavicular line. I'm going to pull up your gown really quick. And there are no signs of thrills, lifts, or heaves present. Next, I'm going to be listening to your cardiac sounds. I'm going to start with her aortic, which is her right sternal border, left second intercostal space. Then moving to her pulmonic, left sternal border, second intercostal space. Then next, Erb's point, third intercostal space, left sternal border. Next, going to tricuspid, left sternal border, fourth intercostal space, and then finishing with the mitral, which is fifth intercostal space, left mid-clavicular line of my patient. I will be doing that first with my diaphragm and then again with my bell. And you can breathe normally for this part. And I would next check her mitral with my diaphragm being the left mid-clavicular line, fifth intercostal space. Now I'll be doing the same thing with my bell. And again, would then be assessing her mitral, fifth intercostal space, left mid-clavicular line. All sounds are present and regular of rate and rhythm with no signs of bruise or extra sounds. All right, and after that, we are going to be moving to your gastrointestinal system. Have you been experiencing any diarrhea?
No.
Vomiting?
No.
Any constipation? Do you have any dietary restrictions?
No.
Okay. And I am going to have you, I'm sorry, when was your last bowel movement?
This morning.
Okay, and was it regular or irregular for you?
Regular.
Okay. And then if you could go ahead and lay back for me. And here is a pillow for your head. And I'm going to lift up your gown slightly. All right, first checking shape and symmetry. Abdomen appears to be symmetrical and regular in shape. There are also no signs of pulsations present. Next, I'm going to listen to your 4 quadrants using my diaphragm. Gastrointestinal sounds are present in all 4 quadrants. If they were not, I would listen to each quadrant for 5 minutes. Next, I'm going to check her aorta using the bell of my stethoscope. Aortic sounds are regular with there being no signs of bruise. Next, I'm going to palpate her 4 quadrants, starting first with a light palpation. Please let me know if you feel any tenderness. Any tenderness? Perfect. And a slightly deeper palpation.
Nope.
Okay, and patient has reported there being no tenderness. There are also no masses or guardings present. All right. And if you could go ahead and sit up. Perfect. And I'm sorry. Have you been urinating more frequently than you usually do?
No.
All right. And how many times a day would you say that you would typically urinate?
Probably about 4 or 5.
Okay. And when was the last time you went?
Probably about 2 hours ago.
Okay. And was it normal or abnormal for you?
Normal.
Okay, perfect. And for this patient, I would assess her intake versus her output as well. Next, we're going to move on to your musculoskeletal system. Are you experiencing any swelling, numbness, or tingling in any of your extremities?
No.
Perfect. I'm going to have you grab my fingers and squeeze. Perfect. Don't let me pull you forward. Don't let me push you back. Beautiful. And next, I'm going to check your feet. Don't let me push your toes up. Don't let me pull your toes down. Beautiful. And all muscles have received a grade of 5. And for my final checks, I would make sure that the call bell was within a patient reach, which it is. And can you demonstrate how you would use that for me? Perfect. I would next check the side rails of the bed. There are 3 up. There cannot be 4 because that would be considered a restraint. And finally, is there anything else that I can do or get for you today?
Nope, that will be it.
Perfect. Well, my name is Marissa. Please let me know if there's anything else I can do for you.
Okay.
All right. Have a wonderful day.
You too, Marissa.
And see.